Hello, thank you for joining me today. Today I'm going to be discussing the material that I made for my assignment for PIDP 3351. This is for assignment number 2. And in this assignment, we are to create a material for our students that can help them to utilize the assessment of, for, and as learning. So I just want to talk a little bit about assessment of learning, assessment for learning, and assessment as learning, and explain it to you a little bit. So assessment of learning is summative assessment. So that's typically exams, quizzes, things that offer a grade. Assessment for learning would be non-graded feedback that is provided by the instructor. And assessment as learning is when the student is their own assessor and they monitor their own learning and ask questions and use a range of strategies to assess what they know and how they learn more. For this assignment, I think it fits well into the assessment for learning and the assessment as learning categories. This is not a summative assessment, and I'll talk a little bit more about how they fit into those areas in just a little bit. So next I'm just going to explain my assignment to you. So in the class that I teach, it is a hands-on lab that I teach, and so the format of these labs is that a skill is demonstrated by myself, and then the students practice that skill. The thing that we practice the most often is phlebotomy, which is collecting a blood sample, and they are usually paired up with a partner, and they actually collect blood from their actual partner. So it's a very hands-on experience, and then I am also wandering around and watching their procedure and giving them feedback as we go. So for this tool that I've created, this assessment tool, they will be paired in threes, and there will be the patient, the phlebotomist, and an observer. And so I've kind of broken down the phlebotomy procedure into multiple different areas that we need to focus on for safety and for accuracy for our patients. And so I have broken it down into these kind of 6 bullet points here, different areas to observe. And then the way that this would work is that the phlebotomist will collect a blood sample from the patient while being watched by an observer. And so the observer is watching, they have a checklist, which I'm going to show you in a minute, and they are paying attention to the really fine details of the phlebotomy procedure, taking notes as this procedure goes on. And then afterwards, the phlebotomist will review that feedback and will reflect on the feedback that they received as well as the procedure and how it went for them. So I start by describing this activity, similar to what I just told you there. Kind of just goes over the layout and some of the rules. And then I have this section about why this activity is valuable. So I think this activity is valuable because it provides the observer with an opportunity to see the phlebotomy procedure from a different perspective. So when you're the phlebotomist collecting a blood sample and you're learning, you're nervous, you kind of don't see the whole picture, you're really just trying to go step by step in your mind. And being the observer takes that pressure off a little bit and allows kind of a different viewpoint of the procedure. This also provides the observer with an opportunity to practice giving feedback in a respectful and constructive way. So we are always working on giving and receiving feedback in our courses. This is a skill that's really, really important to develop in our students. For when they go to practicum, they need to be able to receive feedback and process that feedback appropriately, and then think about how they're going to use that feedback going forward. And it's also really important because one day they are also going to be training students, and so they need to know how to give feedback in a respectful and constructive way as well. This provides the phlebotomist with an opportunity to manage their stress levels while being watched. It also allows the phlebotomist to hear ways to improve their venipuncture procedure, their phlebotomy procedure, and it provides the phlebotomist with an opportunity to practice receiving feedback as well. So I've kind of just included this section to explain the importance of this activity to the students. So then we jump right in. First page is an observer checklist specific to tourniquet usage and vein selection. And so there are questions that the observer would be paying close attention to, checking off if they were done or not, and offering comments. So they're very specific to that specific set of skills that the observer is to be paying attention to. There's a spot here for comments, the date, the phlebotomist's name, the observer's name, the patient's name. And so the observer would fill out this document during the phlebotomy procedure, and then they would give it to the phlebotomist. The phlebotomist can read it, ask any questions that they have, and then they would reflect on their procedure and the feedback that they received from their observer. So, some of the questions: highlight one or two key pieces of feedback that you received from the observer. So this just kind of helps the phlebotomist summarize the information they were given. How do you feel about the feedback that you received? Do you agree or disagree? Do you have any feelings about how you performed? So this gives the phlebotomist some space to internalize that feedback, decide if they're going to keep it and use it later, or if it's information that maybe isn't helpful to them. And it allows them to talk about how it felt during the phlebotomy procedure. This is always a high stress situation. You're putting a needle into your classmate's arm, there's blood involved, and so talking about how they feel is really important here. Next question is, what will you do with the feedback that you received today? How will you apply it to your future practice? So feedback means nothing if we don't think about how to move forward with it and how to think about it as feed forward. And then there's just a question here about level of anxiety. Being watched is also something that our students find quite stressful. And then it asks them here to think about a thing that they could say or do to help reduce their anxiety. So that's about it. With reflection, you want to kind of focus on key areas and not make it too long and cumbersome. So that's what I'm trying to do here. Next section, very similar. It's an observer checklist with questions. Very similar phlebotomy questions, reflection questions here. And they all kind of follow that same format. Now there would be 2 of each of these checklists and reflections, just so that the students can, have 2 different viewpoints at maybe even 2 different points of time. So maybe they do one of these early on in their rounds of practice, and then maybe they do another one later on, closer to when they go to practicum. And you can see how they've grown. They also get viewpoints from 2 different observers, so that's always helpful. And this is in a nice little booklet that they will keep for themselves and then turn in at the end. And then they would receive a participation grade for this. So we're just looking to see that they completed it, that they put some thoughtfulness into their answers. So that's about it for my tool. A couple other things that I want to mention is that I think it's really important to find the balance between assessment of, for, and as. I think all 3 are really important. And so I had mentioned earlier that this sort of fits into the for and as categories for me. And I just want to draw your attention to this chart that I had found on Dr. Hrapnik's website, and this chart is from the Assessment of for As Learning page. And so it talks about assessment of learning being summative, and for learning and as learning being formative. So assessment for learning, the teachers and the peers check progress and learning to help learners determine how to improve. Assessment as learning, learner takes responsibility for their own learning and tasks, questions about their learning and the learning process, and explores how to improve. So I think the part about the observer providing feedback falls under for learning, and then the learner reflecting on that fits into the as learning part of that activity. And then the emphasis for assessment for learning is on feedback, support, and collaboration. And for assessment as learning, the emphasis is on collaboration, reflection, and self-evaluation. One thing I also want to mention, this activity relies really heavily on giving and receiving feedback. And in order for feedback to be given and received in a way that the learner can use it to grow, there needs to be a lot of trust built between the person giving the feedback and the person receiving the feedback. And in this course, we at this point would have already spent a lot of time building that trust in many different ways. So we're not jumping into this feedback giving and receiving just without building a relationship first. And I think that's really important. One more thing to mention, I think that this assignment helps build students into autodidacts, which are learners that are independent and can assess themselves. They are self-directed, and this assignment, I also think, prepares the learner for life, not just for an exam. Thank you so much for watching, and please let me know if you have any feedback or anything to add. That would be greatly appreciated.